All right, so we've now spent a lot of time together focusing on the human body. And what a better way to finish it out than talking about how do you make a human body? So we're going to finish with reproductive. With the reproductive system, I want to go through male reproductive tract first. We'll start with where sperm are produced. Sperm are going to be made in the seminiferous tubules. Seminiferous tubules are housed in the testes. Kind of looks like ramen noodles, so a lot of twisting and turning, and sorry if I just ruined that food for you, but why have so many twists and turns of small coils? It's all about surface area, because at the edges of these tubes we're going to have stem cells. So let's kind of draw a cross section through one. And so at the edges you will have spermatogonium. Spermatogonium are stem cells that will divide to help make sperm. For males, it's a numbers game. For each egg that's going to get fertilized, you're actually going to need a ton of sperm. The first sperm that gets there is actually not the one that ends up fertilizing it. It's going to take multiple sperm with the enzymes that they have in their acrosomal cap to help break down and get through the outer protective coat. So it's going to need a lot. Also, when it gets to the female reproductive tract, there's two directions that actually three different directions that the sperm can go. So you're going to need a lot of numbers because they're not going to know exactly which fallopian tube it's going to need to go into. So it's a numbers game. So we're going to make a lot of sperm. To do that, we got to have a lot of stem cells. Those stem cells are going to be maintained. So as you go through division, you're actually going to reproduce the exact same cell. One will go towards the lumen, the other one stays put. Now I do like to draw it over to the side of it just so you can remember that, like, yes, we are actually going to make two cells, but realistically it's just the same one. So we have the parent cell and then we have the daughter cell. This one is going to be called a primary spermatocyte. Cyte for cell, sperm for sperm cell. And so what we're making here are going to be the sperm for the spermatogenic line, if you will. So spermatogonia, singular, spermatogonium, plural, is going to go through mitosis. So that's this first set of arrows here. So if we look at it this way, mitosis gets you that primary spermatocyte. The primary spermatocyte is going to go through meiosis. So we're going to have another set of divisions. Now this division is done to help make the cell become more unique. And you actually will divide it twice. So the process of meiosis is to split up genetic information. So everybody has two copies of all of the genes. One they got from mom, one they got from dad. So the goal of meiosis is to make genetically unique cells. So when you're done, you'll have 4 genetically unique haploid cells. They have half of the information. So for all of the cells in our body, you have the ones that you got from your mom, the ones you got from your dad. You're actually just going to mix them up here and then redistribute them to make half of the ingredients for a baby. Female's going to provide the other half. So when they fuse, then you have that duplicate diploid cell again. So now to do that, we're going to have 2 divisions. The first division is when the primary spermatocyte becomes a secondary spermatocyte. And then at the end of meiosis 2, we're going to have these unique cells here, which are called spermatids. So meiosis 1, primary spermatocyte to secondary spermatocyte. And then meiosis 2 takes the secondary spermatocyte to become a spermatid. Does it look like a sperm though? That's not going anywhere. It has the right genetic information. It's all cut in half, it's mixed up, but it has to actually become a sperm anatomically by putting on its little cap, its acrosome, and growing a tail. So this is going to be the last step inside of the seminiferous tubule, and that allows us to make spermatozoa, which is the name for a sperm. So spermatozoa are going to be made through the process of spermiogenesis. All of this is spermatogenesis, so the production of sperm. So that's what's happening over here in the seminiferous tubules. So let's write that down. So in the seminiferous tubules, we're doing spermatogenesis. You also will be producing some hormones. And so let's talk about some of the cells that are nearby to help out. Inside, by the way, I probably should show you this. I drew it really small. It doesn't end on the other side. Think of this like ending more in the lumen. Neighboring cells to all this to kind of help support them are going to be our sustentacular cells. they're going to help support and nourish these developing sperm cells. So sustentacular cells are also going to be the ones that secrete the hormone called inhibin that communicate back up to the pituitary and the hypothalamus to say, yep, I'm making sperm, I'm filling the quota. I think of it kind of like the confirmation email you get back from Amazon when you put an order in, like, yep, I got your order, it's on your way. Outside of the seminiferous tubules, you're going to have some other cells that are in the interstitial space. These are going to be interstitial cells. They also produce a hormone. So let's do the hormones in here real quick. So this one makes inhibin. Oh, and also androgen binding protein, because it helps with the protein that's going to come from here. So androgen binding protein. And then this one is going to be releasing a hormone. And if it's coming from the testes, this is testosterone. So that kind of gets us kind of a summary of the cells that we would find within the testes. And that's where those seminiferous tubules were. We should finish the journey now. So seminiferous tubules, we're going to go through that process of spermatogenesis, making the sperm. And then we're going to want to store it somewhere. We got to get them out of the production facility and put it into storage. First thing we got to do is kind of pull it together into a network, and that's the rete testis. IS is singular, ES would be plural. From there, we're going outside of the testes and going into the storage area. And so since we're leaving something, we're going to use efferent, because we've seen that before. So efferent ductules. And then from there into the epididymis. The epididymis is where you're going to have storage. With that storage, this is also the location where they become functionally mature. So one of the things over here that I mentioned is now we have anatomically mature sperm. They look like the sperm, but they don't know how to do the sperm job yet. This is where, and I like to think of it as kind of like the swim school of the male body. This is where they learn how to swim. This is where they become modal. So this is where they're going to become functionally mature. So functional maturation happening in the epididymis. Now all of this is stored outside of the pelvic cavity, out in the scrotal sac. Why put this all out there? Why not just keep it inside of the pelvic cavity? Females keep theirs in the pelvic cavity. It has to do with temperature regulation. So sperm prefer to be about 3 degrees lower than regular body temperature. And so if they're stored outside in the scrotal sac, it's just a thin layer of skin to kind of help keep it cooler, but also help keep it to a consistent temperature by being able to change its elevation. So if the body is cold, then that scrotal sac can contract. There's a dartos and cremaster muscle built into the wall, so it can contract and elevate and get closer to the core to stay warm. If the body's warm, then those muscles can relax, and then it can descend and get further away from the core and cool down. Smooth muscle, not voluntary, say. All right, now, from storage, if ejaculation is to occur, there's a bunch of tubes we got to go through. So from the epididymis, it's going to go back into the pelvic cavity through the vas deferens. And then from the vas deferens, we're going to loop up and around the urinary bladder. So I kind of want to try to draw some of this. So let's do that real quick. So here's our urinary bladder. So let's say this is the anterior side, posterior side. We had the vas deferens that we just talked about, and it's going to come back in from, let's say the testes are out here, so it's going to come back in through the inguinal canal, up and around the urinary bladder. And the job is actually going to, the job this is going to do is to help deliver it to the shared passageway, because the exit for the urinary bladder, the urethra, is actually going to be shared with your reproductive tract for males. So we have the urethra exiting that urinary bladder. Now, surrounding that, right underneath the urinary bladder, is going to be the prostate gland. And so we need to have something to connect the sperm from that vas deferens over to the urethra. And that is going to be right here with the ejaculatory duct. So ejaculatory duct is a little connector piece within the prostate to connect the vas deferens to the urethra. So we're going to go vas deferens, ejaculatory duct, and then from there, we're in the urethra. Now the urethra is going to have different parts. The first part right here is inside of the prostate, so we'll have the prostatic urethra. Then there's a little membrane underneath called the urogenital diaphragm, so it's the floor of the pelvic cavity. And it looks like a little membrane, so we call it the membranous urethra. And then from there, we're going to go out through the penis, through the penile urethra, or spongy urethra. It's also the corpus spongiosum that surrounds it. And then out through the external urethral orifice. Now, along the way, it's not just sperm. You actually have to add secretions into that pathway so that way the sperm have room to move, they have nutrition for the movement, and also some other things that could help along the way. So we have 3 accessory glands. Remember, accessory glands are things that secrete into a tract but are not part of the tract. So they're going to go into the ejaculatory duct, the prostatic urethra, and the penile urethra. The first of the 3 is going to be the seminal vesicle. Seminal vesicle is going to secrete into the ejaculatory duct, and the secretions here are going to be things like sugars and prostaglandins. Sugars, so that way the sperm have something to eat and break down so they can make ATP to become mobile, so it can act, so it has something to make ATP to swim. Prostaglandins are hormone-like secretions that are actually for the female reproductive tract. They stimulate uterine contractions. Because when the sperm get to the female reproductive tract at the vagina, how do they know where to go for fertilization? The site of fertilization is up in the uterine tubes. Sperm's never been there before, so it has to be able to trigger uterine contractions to then kind of push them in the right direction. So I always like to think of the seminal vesicle as going to be where you pack a snack and ask for directions. Then we go down to the prostatic urethra, and if it's the prostate surrounding it, it would make sense that the prostate's what's secreting into it. So then we have the prostate that's going to have things like citric acid as another nutrition source. It'll have seminal plasm. It's an antibiotic to prevent UTIs. Interesting. Males have an antibiotic to prevent UTIs. Females don't. And anatomically, males are already kind of set up in a way that they're probably not as likely to get a UTI because the exit to the urethra is further than the rectum than what females have. But they also have an extra feature there with an antibiotic. There's also going to be an alkaline mucus. The female vagina is acidic. It's one of the protective features for the female reproductive tract. So for sperm to survive in that environment, they have to be able to neutralize that acid. And then the last thing that they're going to secrete is prostate-specific antigens. And I really just kind of mentioned that so you're just aware of that. That is something that we can track. If there is something going on with the prostate, like prostate cancer, they can actually use that as a marker to see how much is beyond normal. All right, then we have the penile urethra. So these are going to both secrete during ejaculation. So they're going to be part of the ejaculate being these secretions plus the sperm. Most of it, 60% of it's coming from the seminal vesicle. This one, however, is secreting before, and it has to do with the fact that it's going to secrete here to clean out any of the remaining acids from urine and also provide lubrication for sexual intercourse. So this one is the bulbourethral gland. And again, it's going to have a mucus that is going to be alkaline to counter the acidic environment inside of the female, but this one's going to be thicker because it's providing lubrication. So it's a viscous alkaline mucus that's secreted before ejaculation. So when you're looking at the order of events, sperm's going to be made first, it's going to be stored, secreting from the bulbourethral gland, ejaculation is going to occur, so we're going to leave the storage, we're going to add secretions from the seminal vesicle and the prostate for nutrition and also stimulating uterine contractions in females, passing all the way out through the male reproductive tract and then entering into the female vagina. All right, hopefully that makes sense. Thanks for watching this one.